Hello everyone, this is Lady, your nurse reporter, and today we're going to talk about evidence-based solutions for human trafficking and the impact in the nursing profession. Many of the human trafficking situations and victims they seek for medical assistance during their first time of exploitation, but many of them, most of the time, they go unrecognized. About 90% of the victims of human trafficking here in the United States access medical treatment and they look for medical assistance during their lifetime of exploitation. Human trafficking is a form of modern day slavery, and it involves forcing, defrauding, or coercing of someone, of people, into labor or into commercial sex, or even though purely slavery, and that goes against their will. Human trafficking happens everywhere, and inclusive it happens here in the United States of America. Many victims have often seen in primary care facilities, emergency rooms, OB clinics, even dental, even seeking for dental assistance in dental places. All these victims they come into medical treatment at least once during their lifetime into slavery. This type of victims they can be anyone. They can be you, they can be me. It can range from adults go to children. It can range from US citizens. It can range to undocumented people, male, female, transgender, or non-binary. um, they can be trafficked for many type of situations of many purposes, but mostly we see human traffic for sex, for labor, or for illegal activities. Now, as healthcare workers, us, we might be the only net, we might be the only filter, that only point of contact that these victims could have. And it all depends if we do have proper education to filter these type of victims when they come and seek care through our facilities. Now, once we get into the point and we get into the scenario that we have a human traffic victim, what do we look for? Now, we need to be very careful because not only the subjective information we get from our patients is what we're going to use. We need to be more objective and we need to be more thoughtful. So, the hints and the red flags that we have to look for once we encounter this type of scenario as healthcare workers is always there's going to be a third person involved. This person will always speak for the patient and it will be reluctant to leave the room. It will be reluctant to let us have a proper conversation, patient to healthcare worker. The patient, most of the time, will avoid eye contact. It will be presenting very anxious. It will be very submissive. Um, it might not want to interact with you as a healthcare provider and will wait for this third person to come around and answer all the questions for them. Most of the time they don't know the city they are in. When you make those basic questions of, you know where you are, you know your full name, you know your date of birth, let me see your ID. Constantly they show up without an ID. It happens that someone else have the ID, they do not have their identification with them, but the ID is not present. Their histories most of the time are inconsistent, or they have memorized this type of answers that even before you make a question for your patient, they are answering you with the memorized answer they already have. So our patients physically they will present with poor grooming, um, maybe malnutrition characteristics, poor hygiene. And once we are doing our thorough assessment on these patients, look for pelvic pain, look for pregnancy, look for STDs, look for trauma, injuries in their body, healing on different stages. Sometimes also we can recognize certain type of signs or tattoos that have been embedded in their bodies, and they belong to the actual gang or traffickers. And definitely, this patient will never speak up. They are afraid. They will never tell us. It will be really, really difficult to create that safe space for that patient. So once we have all these questions in order, once we make and create that safe space, we can interact with our patient directly. Once you have a medical reason to get this third person out or away from the room, you can proceed. You can make open questions for this patient, but first you have to build in that trust. You can ask questions like, where do you live, where do you work, do you feel safe at home, can you come and go from home as you please? And based on that, we can make a determination. It is very important that we document all this objective information and also what we see. Now, the next step is, who do we contact? Follow your facility protocol. Contact your healthcare provider, contact the social worker, contact your nurse manager of the floor, contact security manager, and just follow your facility protocol. Do not confront the suspected trafficker, because your safety and your patient safetyness, they are at risk. So always act discreetly and create that safety net. Now, remember that these patients are most of the time traumatized, and they will not um, approach you as easy. So we have to create that safety space, and we have to um, make that compassion bonding with our patient. Human trafficking is hidden. It's most of the time we walk through, we don't even notice, but it is important that we get educated and properly trained to go through all these steps, and we are able to recognize once our patients are seeking for this type of help. Um, a cross-sectional study that found 20% of the healthcare providers that were educated about human trafficking clues were more to identify human trafficking survivors within a year, in comparison to 8% of healthcare providers that were not educated. So we have to do two things: educate ourselves about human trafficking and spread the awareness. Also, we have to keep in mind our safety hotline. It's the National Human Trafficking Hotline, 888-373-7888. And I think we have run out of time. So we see you next time.